Trump has said he would like to get rid of the pharmacy benefit managers. What would that mean?
So they're an unnecessary middleman. I think what needs to happen is if you get rid of the pharmacy benefit managers, you get rid of a huge profit center for the insurance companies. You take away their incentive to keep you on prescription drugs. Now they're de-incentivized because you're costing them money. If they don't get those rebates, they're losing money by you being on prescription
drugs. So they've done a secret deal that you don't know about as a patient
100%.
To steer you towards certain drugs and away from other drugs.
Absolutely. And they even have a safe harbor with the federal government. The federal government doesn't, this is insanity, Tucker. The federal government does not have line of sight into Medicare and Medicaid and why the prescription drugs are costing them that much. So what the insurance companies do.
What does that mean?
So I'll explain. Let's go back to insulin. We'll just make up a drug. Drug A is let's say the insurance company tells the people the average wholesale price in America for this drug is $1,000 a month. They never paid the $1,000, they paid $500.
Right.
They tell us, because the rebate, they tell us it's $1,000. Okay. Now they've set the average wholesale price because they're the ones that set it. Then they negotiate for Medicare, Medicaid with the federal government. And they say, hey, federal government, since you're our buddy, we'll give you a price break. We're going to sell it to you for $800 a month. Better than anywhere in the country. You're getting a $200 price concession per month on this drug. They didn't pay $800. They paid $500. They made $300 off of the federal government every month. And who paid that? Me and you.
And federal regulators don't know that?
There is a safe harbor, and that's what people are trying to peel through. They're trying to get rid of this safe harbor, and I think the Senate had a investigation they launched, I think 2 years ago, on the cost of insulin. And so when we talk about people celebrating the death of this CEO, it's terrible, but I'm trying to get people to understand where this anger and animosity comes from.
Well, I think it's a fair question.
People are catching on to the magic trick, and they're going, wait a second, you are screwing us. And the reason my cost of healthcare is so expensive and I can't get my surgeries and my kid's addicted to opioids and my wife is, dying of cancer and I'm fighting with you to get this coverage is because you are literally printing money off of chronic disease. It is not about patient lives and patient outcomes. It's about profits. And they're killing it all the way to the bank.
So if I'm a health insurance lobbyist and I'm like trying to convince the administration or the Congress not to get rid of pharmacy benefit managers, what argument am I making?
They're going to come in and say, if there's no pharmacy benefit managers, we're an advocate on behalf of the people. We negotiate down the cost of prescription drug care. Federal government, if you look at this and add the numbers up, the average wholesale price of every drug in America times the amount of patient lives in America, and then I say I'm giving you a 30% price concession on all of the average wholesale price, I can make the math look good. But like I said earlier...
But the wholesale price is fake.
It's fake, yes. Like I said earlier, there's liars, there's damn liars, and then there's statistics.
So they control the baseline, so they control the outcome of the equation.
Bingo.
Right. Okay.
Bingo. And then they control the copays and deductibles, which drive the behaviors of the patient. So, if I'm some guy working on an oil rig and I'm working my ass off and I'm exhausted and I'm on 4 more meds and one med is a $20 copay and addictive and abusive with side effects, but the other med is a $100 copay, what do you think most people are going to take? And I think y'all covered this with Callie and Casey, who are my buddies, but the third leading cause of death in America is medical misuse. And and that's with us reporting less than 2% of adverse events.
Well, exactly. How many people die of acetaminophen every year? A lot. Thousands. Many thousands. Right. It's just an over-the-counter drug that is, by the way, useful. I'm not attacking it, but even a drug as simple as that can kill you.